I think. So Femara we'll probably dispense with. It's another aromatase inhibitor. There are 3 in the class: aromacin or exemestane, arimidex or anastrozole, and Femara or letrozole. Each drug has a brand name and a generic name. There is a huge marketing battle between those companies. There might be some subtle differences in the way they work. But for most women, that's a discussion they'll have with their doctor. I frequently tell patients I'm prescribing the one that's from the company that's annoyed me the least in the last couple of months. It's very hard to come up with another hard and fast rule for selecting those. Now, Herceptin or trastuzumab is a real focus of interest of mine, and I know of Marc's in particular. Maybe I'll start off and just say that it is a revolutionary drug. And I want to point out to everybody in the audience, we're shifting gears when we talk about Herceptin. The reason we're shifting gears is right now it is not a drug that's being used for prevention, although I will point out to you it's actually being tested in a very small study to treat early cancer for just 1 or 2 doses. But Herceptin is the first real immune therapy for breast cancer. And it's worth describing it that way because it's an entirely separate class and approach from chemotherapy and from hormones. And what Herceptin does, very simply, is it attaches itself to something called HER, H-E-R-2. And Marc is a pioneer in this field, so he'll embellish this. But when we give Herceptin, we have the risk of breast cancer returning after surgery. That's the simple bottom line, and we extend life when we treat advanced breast cancer with it. So with that as an introduction, Marc, you may want to add a good bit here.
Well, I won't go on too long, but I hope. But
it's so tempting, though. It's such an exciting area of science.
It is exciting, and the reason fundamentally it's exciting to me is, as you recall, I said at the beginning in my introductory comments there were 5 different kinds of breast cancer, and each one had a different cause. So the first thing that really is incredible here is that when all of us started becoming oncologists, and you'd say, well, what causes breast cancer? No idea. We knew things that might contribute. We had no idea. This is a specific cause of about 20 to 25% of breast cancer. It's caused because one particular gene gets overexpressed, and this gene is an engine that can drive breast cancer to grow. So breast cancers have, like antlers on a deer, all of these receptors decorating their surface for HER2, and we've come to know that this is the cause of someone with breast cancer. And so it seemed logical to make an antibody that would identify this receptor on the surface of the cell and see if you could use that antibody to somehow cover it up or keep it from working. And this turns out to be the case. And make no mistake about this, how excited, you can see how excited I am right now. I mean, it's so exciting because suddenly that which was mysterious became a lot clearer. A specific cause of the disease was identified, a specific therapy targeted to it, not just chemotherapy or radiation, but an antibody that would only interact with that one thing. And women improved. And then as we do, we advance these studies to earlier and earlier, and now this has been the most spectacular home run in treating women who have already been diagnosed with breast cancer, whose tumors have this on their surface, with dramatic increases in survival. So as soon as you get your toe in the door, you can grow with that, and now there are small drugs that you can take as pills that look even more exciting, frankly, than Herceptin, which target this pathway. And I think that this is going to be a gigantic new era in targeted therapy. It couldn't be more exciting.
So one of the things that I want to avoid confusion on is Marc made a point that this is a cause of one kind of breast cancer, and that's absolutely right. But I know that for many of you, the wheels are turning. You're saying, well, how do I prevent that kind of breast cancer? And we're not yet able to narrowly define what kind somebody would get. So understanding the cause biologically in the laboratory is different from necessarily being able to stop it from developing. And that's maybe another challenge for another day for us.